And you do need to alter the probe and put it at a certain angle to try and get as much of the diaphragm as you can. But that's where you'll first see free fluid on that left-hand side. This is probably an unfair question. IBC? No, it's not the IBC. So this is just to, I mentioned before on the right-hand side, to be fanning anterior and posteriorly. When you fan anteriorly on the left-hand side, you will come across this sort of very amorphous looking object where you actually get lots of white, which is caused by a bit of air, and sometimes you get how should we say, a bit of breakfast sitting there. So as you go anteriorly, you will come across the stomach. So just be aware of that. Don't think that that's some sort of funny organ or mistake it for the kidney, because that can be a common mistake that people make. So now we move down into pelvis. Okay, and we want to have a look at the pelvis in two views. The most important thing about the pelvis, and for our students they need to notice as well, is that you need to get quite low in the pelvis, so you need to put the underwear so it's just on the bony part of their hip, so that when you, and they can cover themselves with towels, but the probe head must be always on the skin, otherwise you'll get interference from the towel or whatever you're using. And you need to, your probe marker, and that is pointing towards the head, but you rock the probe down, so, I'm not sure what's going to agree here, but you must hit the bone, the symphysis pubis. And the symphysis pubis will cast a shadow here, and the next structure that will appear will be the bladder. Okay? And you get the bladder in longitudinal view. What is the rock? Oh, the German rock the probe. Okay. Rock. So in other words, so my marker is going towards the head. And essentially what I'm doing is I'm rocking down, so it's movement in this plane, and to make sure that I actually do hit the symphysis pubis. So I must have bone on that side, and then I know the next structure that's above that is going to be the bladder. That becomes very important to try and distinguish between the bladder, which has got fluid in it, and fluid that's outside the bladder, that is the free fluid we're looking for. And then we have our transverse view, and that often looks a bit more like a box. And just so our students know, please don't go to the bathroom now, okay? Because we want to have some bladders, if that's all right. And below the bladder, then you will, on the man, you will see the rectum. And so on our transverse, our marker, probe must be towards the right-hand side on the abdominal segment. And this is one of the things that I was telling you about before. Remember how I said as the ultrasound machines are very clever, but they're only as clever as we make them, so that they compensate by saying that the ultrasound waves are all going at one speed, okay? And they say, okay, well, if they're going at one speed, then I'll send my impulse out, and because I know that at depth it's going to become degraded, I will enhance the ultrasound as the deeper it gets. But because sound travels through water or urine, whatever water, really fast, it goes really fast through here. And so the back end of the bladder is enhanced by the machine. So, but it's too enhanced, and it washes it all out, and you get this appearance. So you actually need to turn down the far gain beyond the bladder in order to be able to see the structures. And this is our male pelvis and the views that we get, longitudinal transverse. And we're expecting to see fluid here, and we're expecting to see fluid either side here. I'll show you some examples in a minute. There are the seminal vesicles that actually sit here as well. So there are some structures, of course, seminal vesicles in a female particularly. You'll have the pelvic vesicles that will also look dark or anechoic as well. And sometimes the transverse views can look quite confusing. So your eye needs to get into, just to see what is normal and what isn't. the sort of picture that we're trying to see. Anyway, there's the bladder, and there's the outline of the bladder, and this is free fluid here. That's our symphysis. Remember, it's got the posterior acoustic shadow, you've got the bladder, and you've got free fluid there. And then we go to the female pelvis. Of course, we've got this is the longitudinal view. Here we have the vagina, and we've got the uterus. And then we go to transverse, we've got the uterus here, and we've got the rectum behind. And then we're going to inspect some fluid that will appear behind the uterus. And here we are in the pouch of Douglas here. So this is someone who came in with pelvic pain and a positive pregnancy test. And you can see here, this is the bladder, here is the uterus. You can see that anechoic area, that dark striping area here, it's free fluid. And you can see it also here, this is the uterus. You can see some fluid here. But we can also see, this is Morrison's pouch. You can see the anechoic stripe. This is it turned actually transverse, so we can see it even better. And on the other side, this is our spleen, this is the diaphragm, and between the spleen and the diaphragm. Let's just go through a few images. Free fluid or no free fluid? What's this?
Kidney.
Liver.
I think that's the wrong one. I think you're right. I think it's the liver. Often we're terrible at changing the markers, right? And you can see this here, yes? And sometimes it's not completely clear. The longer the blood stays in the body, of course it becomes more solid, doesn't it? The serum separates away, and it can start to look more solid, and eventually will look very similar to the organ that's around it. What about this one? This is the left-hand side, I think. Is there any free fluid?
It's lower border. Yeah, yeah, little bit. Yeah.
Starting to appear.
Yeah.
Where's the bladder? Your turn. Show the bladder.
Gallbladder.
Oh. So where are we? What's the orientation? What is this here that's casting a shadow? This is a longitudinal view. What's casting this shadow here? Anyone helping?
Pubis symphysis.
Symphysis pubis. What's the next thing that appears?
Renal bladder.
That's the bladder.
Bladder.
Is this a second bladder?
No. Fluid.
This is
That's
uterus,
true.
you know?
And this is bowel and sloping. The pictures are not necessarily reflected very well. Yes? Morrison's pouch?
Yes. Liver. Kidney.
Yes? Free fluid? You can
Free
see
fluid,
that?
yeah.
Free fluid, yes.
So your mind's getting in, you're recognizing this is the liver, this is the
Kidney.
you're recognizing
And then
the
And
structure
there
of
is
the
a-
kidney, and how it's got that nice white sinus in the middle. Now, sometimes you can actually see some injuries. This is the spleen. Again, doesn't project very well, but you can actually see some changes there, but don't worry about that. Now we have a lot of free fluid. And this is another person. This is someone who fell off their mountain bike. We've been talking about mountain bikes and falling off them. And I'm sorry it doesn't project very well, but this is their spleen, and there's a stripe of fluid sitting here. Now back in the pelvis. How many bladders do they have? One. Where is it? This one. So be very wary, because sometimes you're thinking, oh, I'm just going to have a look at the pelvis, and you come across an area of fluid, you're expecting to find the bladder. But sometimes the actual thing you find, first of all, the actual thing you find is the free fluid. So, that's it. You can see the bowel is floating in there as well. this is the guy who fell off his mountain bike. This is a CT scan, and he had a ruptured spleen here. So, as I've said before, not all fluid is blood. In your context, there are other reasons as to why people have free fluid from their ascites and from the other diseases they have. You can have these other conditions, but in the right context of someone who's coming in with trauma, and of course, if you find free fluid in the abdomen, it leads you in a certain direction and gives you very important information. And we spoke about the changes of blood as well, how it can start off looking that dark and echoic, but become a bit more solid thereafter. So now just quickly move to the subcostal area. Now I'm talking about this in this slide show, but we'll actually talk about it in a cardiac lecture. But as far as the original fast is concerned, when ED physicians did their fast, they wanted to stick with one probe, so they used the abdominal probe. And so with the abdominal probe, the marker points towards the right-hand side of the patient, and they would put this in the subcostal area as well to produce those images. We will be using the cardiac probe as well for this subcostal area, and as well when we look for the heart itself, we'll be using a different probe. Now, because we'll talk about it a bit more later on, this is just a bit of a simple slide. So, what's this organ here?
Heart.
So, as we come through here, go through the skin, pass through the liver here. So what's between the edge of the liver and the heart? Yeah, fluid. So that's a pericardial effusion. So that'd be one of the things that you'll be looking for. And that one actually does have our physiology, so you may need to talk to somebody about correcting that. And also sometimes when we look in the abdomen, it may be very useful for us to determine as to whether the heart is beating or not. So you've had your ALS course yesterday, you go through your algorithms, and looking at the subcostal view of the heart can inform us as to whether there is, whether there's any contractility or not, and determine as to whether your resuscitation may or may not be futile or not. But this is a heart here that's not actually contracted. So, what I'd say in New Zealand, perform a fast if it would change your management. So just recognize the reasons why you might be doing a fast, and recognize the issues that are around that. Of course, while you're learning and for practice, you may be doing fast on different people, but have in your mind the reason why I'm doing it is for my own learning. The implications allows you to do that, but just be cautious that it is a necessary thing to do. Remember that blood pools in those dependent areas. And those ones that are stable, they may have a negative fast scan, you might need to repeat that scan over time. Remember the amount of fluid you need, which isn't 15 mils, it's a lot more than 15 mils. Okay? So just need to be aware of that. And blood will change over time and will confuse you and start to look like normal tissue. It's not great, remember its limitations, it's not great to actually find necessarily the organ that might have been injured, just to show you that there's fluid there. And if there's a retroperitoneal fluid, we might see it a lot more with people who have ruptured aortic aneurysms, and they may have some free fluid that's behind the peritoneum. We don't see that, so recognize that as a limitation. I thought I took that last time.